Hello, my name is Cindy Abear, and I'm going to be talking about the drug phentermine, also known as Atipex. This drug belongs to the drug class of antirexiants. The mechanism of action, it stimulates the satiety nervous centers in the hypothalamus and limbic region of the brain. Phentermine is used therapeutically to treat obesity in adults. The route of administration, phentermine is only approved for oral use. The doses, you can have an 8 milligram, 30 milligram, or 37.5 milligram tablet, or there's also capsule forms with 12 milligrams, 30, or 37.5 milligrams. An adult can take 8 milligram orally 3 times a day, or what's recommended is a 12 to 37.5 milligram dose of this drug daily before breakfast, because this drug does cause insomnia in some patients. Some drug interactions with this drug is MAOIs, because there is a risk for hypertensive crisis. Monitoring, patients should monitor their weight while they are on this medicine to determine if it's effective or not, and patients should also be monitored for signs of addiction. Some adverse effects of this medication include agitation, high blood pressure, confusion, dizziness, cardiac arrhythmias, constipation, headache, and insomnia. Phentermine is contraindicated in patients with a history of abuse. This drug can lead to addiction in patients, and they should be educated on that, and they should also be educated on performing other dietary weight loss treatments that they could be using instead. Treatment is usually less than 6 months with this drug due to the high risk of addiction. And something interesting to know is that it is excreted through the urine. Thank you.